Hello everyone, welcome to my YouTube channel. Today's video is going to be for our medical students out there, those who have recently graduated from medical school and those who are doing their house job at the moment and are thinking of taking the Plab exam and move to the UK as a doctor in future. So in this video, I'm going to discuss different strategies that I think are really important and you should be working along those lines if you want to clear your Plab exam and start your NHS journey as soon as possible. So, for those who do not know, Plab is basically a short form for Professional and Linguistic Assessment Board, which is a series of exams that you are required to pass in order to get registration with the UK's Medical Council, which is known as General Medical Council, and to get your license to practice in the UK. So, what are the different exams in this series? The first exam that you are required to take is OET or IELTS, which is an English language exam. The second part is Plab 1 exam, which is basically an MCQ exam. And the third and the last part of the series is Plab 2 exam. And Plab 2 exam is basically a practical exam. It's just like an OSCE. And it tests your knowledge, but most importantly, it tests your communication skills. Okay. Now, regarding the timeline, there is no specific requirement for OET or IELTS. You can take OET or IELTS, in any year of your medical school, but they expire within 2 years. Okay. And for Plab 1 exam, in order for you to take Plab 1 exam, to book a seat for the Plab exam, you need your MBBS degree with you. So I would advise not to take OET or IELTS during your medical school, but after your final year exam. So depending upon the time that you would require for your preparation, maybe 2 months or 3 months after your final year exam, try to take your English language exam, and then you can take your Plab 1 exam during your house job and maybe Plab 2 exam after your house job, or maybe during the last rotation of your house job, depending upon whether you are able to book an early seat or not. Okay, so that was about the timeline. Now, regarding the strategies that I want you to work upon or to practice, the first one here is language proficiencies. So language proficiency is important, but keep in mind that they do not want you to use or learn sophisticated language. They do not want you to become the editor of Guardian newspaper. Rather, they want you to be able to interact smoothly with your patient and to use the normal daily life English smoothly and fluently. So try to practice your, English language skills and work along those lines. Practice your listening skills by watching movies and practice your speaking skills by, talking as much in English as possible, practicing with your family or maybe practicing with your friends, etc. The second thing is exam familiarity. So you should be aware of the format of the exam, okay? What this exam is all about. I get many questions from medical students that, where should I study physiology from? Where should I study pathology from? For Plab exam, whether I should study VRS pathology, whether I should study pathoma, what about first aid, etc. But the Plab exam is basically a clinical exam. It is about your clinical subjects, which means that your final year subjects and some of your fourth year subjects. So MCQs in the Plab 1 exam are mainly from medicine, surgery, obs and gynae, pediatrics, psychiatry. Psychiatry is really important, a really, really important subject both in Plab 1 and Plab 2 exam. So psychiatry and ophthalmology and ENT. And maybe about 10 to 15 MCQs might be from the basic subjects like anatomy or pathology. But mostly this exam is about your clinical knowledge. And Plab 2 is again your clinical skills. So clinical subjects are more important for this exam, whereas basic sciences subjects are more important for USMLE step 1. So try to be familiar with your exam format and work along those lines. Okay, the third point that I want to make is the importance of networking and guidance. So try to network socially as much as possible, bring a strong social network, not only with your seniors who have passed the Plab exam, but also with your colleagues as well, who are, thinking along the same lines and preparing for the Plab exam. So, because when you have seniors, when you have good, good interaction with seniors who have passed the Plab exam, They can guide you really better. You can, ask them any problem that you are facing. You can even practice with them when you are, practicing for your Plab 2 exam and ask for their feedback, which help tremendously. But when you are networking with your colleagues who are preparing for the same exam as you are, then you can motivate each other, especially during your house job. You can, practice with each other in the hospital, right, to motivate each other, and it really increases your chances of success. The fourth part here is research and audits. So regarding research and audits, what you can do about this part here is we all know that during our undergraduate study, we are required to take one research project. So try to take that research project seriously and to the best of your abilities. Or, write your research projects to the best of your abilities and try to get it published in some local journal, etc. So this is going to give you some points as well. Audit is really important. I will advise all of you to do an audit. And the best time to do this is during your house job. So this is actually a very basic requirement in the NHS. And if you have done audit, then you will be, far ahead in front of your other colleagues. So audit, try to do it during your house job and try to get a formal letter from your either your ward registrar or ward consultant that you have done this audit. So even if it doesn't get published, you still will get marks for that. Then teaching. So what can you do for teaching to get marks in the teaching part of your CV? One thing is to get, a demonstrator job in a medical college after your house job. But not everyone will be able to do that. So you can try informal teaching as well, because it's not necessarily formal teaching that is required from you, but you can do informal teaching. Informal teaching means that when you are doing your house job, you can teach the undergraduate medical students. Maybe you teach them how to do respiratory examination, cardiovascular examination, etc., and get an official letter from your ward registrar or ward consultant that you have been teaching the medical student. Okay, try to get everything documented. So this is going to give you, the marks required for teaching. Or what else you can do? You can, maybe come up with, try to teach, medical students on social media, make some educational videos on social media, or make some educational videos on YouTube. So this is also going to give you the marks required for teaching. Then management and leadership skills. This is another aspect in which many candidates are lacking, because this is quite unheard of in Pakistan. So management and leadership skills, what you can do about improving your leadership skills. So while you are in medical school, you can organize either any co-curricular activity, or maybe you can organize a medical camp or a blood donation camp and try to get, a documented certificate from your medical school that you have done this co-curricular activity or you have organized this medical camp, etc. So this will show your leadership skill. Okay. Also, even if you are basically the CR of your class, or you are the batch leader of your hospital batch, and you get a certificate for that, that also shows your leadership skill. The seventh point here is presentations. Presentation is not a difficult part. Every one of us, each and every one of us, we give presentations during our undergraduate studies, during our house job, during our training. So the important point here is to get a certificate for those presentation from your ward or your medical school that you have presented this particular topic on this particular date, and your audience were, I know, undergraduate medical students and the faculty, etc. Then distinctions and awards. Distinction and award basically means getting a distinction in a particular subject. It does not mean necessarily being a topper, but even being in the top 10 of your, maybe final year medical exam. Being in the top 10 of your final year medical exam also has the same marks. So this is another point that can give you an edge. The 9 point here is clinical exposure. So this is a clinical exam. It's all about the clinical knowledge and clinical skills. So try to get as much clinical exposure as possible when you are a medical student. Try to interact with patient as much as possible. Try to improve your history taking skills, your examination skills, your communication skills. Um, when you are in your house job, try to talk to the patient as much as possible. Try taking a good history from each and every patient. You should be really pro at history taking of each and every symptom, the common symptoms like cough, like chest pain, like fever. You should be able to rule out the differential diagnosis. You should be able to rule out red flags. You should be able to, triage the patient, whether their condition is, severe, which level of care they require. Um, so a good history taking is important, but not only you should be able to take a good history, you should also know what relevant examination you need to perform based on the history that you have taken and what relevant investigation you need to order and the basic management of these medical conditions. So a good place to start will be I have uploaded videos of all the common all the common symptoms that come up in Plab 2 exam, like cough, like chest pain, shortness of breath, abdominal pain, tiredness, falls, etc. So try to watch those videos. They are not only important for Plab 2 exam, but they will also give you a very good medical knowledge and you will be able to take a good history from your patients during your house job. You will be able to rule out the red flags. You will know what to safety net your patients about, all the skills that are required from a safe doctor. So I hope this was helpful. This was all for today from my side. I hope this was helpful. I wish you best of luck in all your pursuits. And if you found this video helpful, give a thumbs up and subscribe to my channel if you haven't already subscribed. I will see you soon with the next video.